Awesome. And then I am going to be sharing my screen. So let me get that up. And then Tim, Wendy, who am I passing it to here?
I can jump
You,
straight in, or Wendy, I don't know if you have anything you want to say before I dive into my spiel.
you go ahead, Tim.
All right.
Let me just
Well,
get this.
thank you to all of you for joining me online here. Appreciate the opportunity to speak with you guys. My name is Tim Doherty. I am a nursing manager at St. Luke's in Boise, Idaho. Um, I'm going to speak to you guys today about what I, as a nurse manager, and speaking with some of my fellow nurse managers, what we're looking for in new grads coming to various departments. So that's kind of the basis of my presentation. On the next slide, kind of run through what the agenda is here. I'll kind of talk a little bit about my personal philosophy on the NCLEX, what our expectations are, kind of leading into job interviews and those sorts of things, applying for jobs, and then the actual interviewing process, and what me as a nurse manager would be doing to prepare, but also things that I think would be beneficial for you as a prospective employee to prepare for. Next slide, please. So again, my name's Tim. I've been a nurse in many different capacities, and this is one of the beauteous things about being a registered nurse is there is a lot of different opportunities out there. My career has been within the walls of the hospital, but there's nurses at schools, there's nurses on cruise ships. I mean, there are nurses all over the place. I saw something in my spam inbox about being a nurse on an oil rig. So I mean, it's crazy. You can work anywhere. But I've worked in lots of different capacities, mainly in the ICU. And then I've also worked as a house supervisor during COVID, and now I'm a nurse manager of a 35-bed telemetry unit. Next slide. So, as people are ending their nursing school and kind of looking towards graduation and the next major hurdle, the NCLEX, in my position as a nurse manager for a telemetry department, we really are a very common starting point for a lot of people to start their nursing careers. I have my personal philosophy on taking the NCLEX, and I've spoken to a lot of people that have gone through the NCLEX process, and this is kind of a summation of what my takeaway points are from this. I think the biggest thing that I would recommend to people is take the exam as soon as possible after you get your authorization to test. Nursing schools, one of the things that they really want a good score on is how many of their students pass the NCLEX first time or early on, right? They really want you guys to be successful in the NCLEX exam. And so somewhere in that last year, they're doing all the prep to get you guys ready to pass the NCLEX. So barring some really unique circumstance, testing as soon as you can, you're going to be in the best possible position, generally speaking. So that's my 2 cents there. And the next thing that I would recommend is when taking the NCLEX, and you probably got a lot of this through your test prep, whatever that looks like for your particular school, but think like a test taker. Don't think like a nurse. And this is really a pitfall that I've seen a lot of nurses fall into when trying to take the NCLEX. They're thinking too much into the question and not answering really what it asks. So think like a test taker, not like a nurse. That's my second point to really be successful with the NCLEX. And then finally, if you don't pass the NCLEX on the first time, don't panic. You're not the first person that didn't pass it their first go around. And, for me, people that I've hired that are looking to take the NCLEX, if they haven't passed the first time, I reassure them that their spot is still here. We still want them. We still love them. They're welcome here. So don't get too spun up on whether or not you passed the first time. One story that I like to talk about, one of the best nurses I've ever known, a guy that was a ski guide, a rock climbing guide, ski patrol, ended up working in the ER, fantastic nurse. Took him 3 chances to pass the NCLEX because he was thinking too much like a nurse. So it really does not reflect on how good or how successful you will be with a nurse. It's really just making sure you understand the content. So again, think like a test taker, and if you don't pass the first time, don't panic. All right, next slide, please. So talking about some expectations, I would ask you all, as you're starting to look for jobs and see what's out there, really understand what your expectations are. Where do you want to be? What specialties, what areas do you want to be? And there's a lot of common places where people want to be in specialty areas. So then my next bullet point is, what if that's not available in your first go around, in your first years as a nurse? What might be acceptable alternatives to help you get to where you want to be? I'd mentioned that, on telemetry, I hire in a lot of new grads, and we really start a lot of people on their nursing careers into specialty areas, into adult ICUs, into pediatric ICUs, into neonate ICUs, into the ED, women's, children's. A lot of people start here, and then eventually, they really develop their nursing practice, which will allow them to be successful in any of these specialty areas. So really kind of thinking about where's my end goal, but also thinking, what if that opportunity isn't available at the outset? What are acceptable backup plans? And charting a course. And we at St. Luke's really try to work to chart a course to where you want to be over the course of your career, even if that doesn't mean landing there the very first step out of nursing school. And then a big thing that has come through the pandemic and just the way that healthcare really has changed, it's really taking an impact on my staff. I see, younger nurses that are really kind of burning out. And I think one thing that we really need to focus on is self-care. And I would just, from the beginning, even before you start into your nursing career, understand how to care for yourself and what fills your bucket, whether that's friends, family, exercise, whatever, but prioritize that stuff. And you've worked really hard to get into the nursing field. The last thing that I want to see is somebody leave nursing because of burnout that could potentially have been avoidable. So yeah, take care of yourself. It's important. You're important. All right, next slide, please. So looking at applying for jobs, I recommend do research. Know what's important to you. Focus on these. Look for magnet type institutions. We're going for another magnet designation at St. Luke's. There are other types of designations like magnet. There's can't think of some of them off the top of my head right now, but these really indicate how much staff involvement hospital systems or hospitals have. So a big thing for the magnet designation is self-governing. So we have like our bedside team really participate in solutions to problems, in quality metrics. Really, the bedside team is our most important workforce. So we want to include them in all the conversations that affect the work that they do, that ultimately affect the care of our patients and create better outcomes for our patients. If our staff are good, if our staff are happy, patient outcomes and patient experience is just so much better. So understanding what facilities support you as a person, not just you as a number to fill a position. I think that's important, and it's becoming more and more important as the workforce is evolving and changing. Like I said in my last slide, be open to multiple areas when you're beginning your career. I know it's hard. You kind of have this mental picture of where you want to be, where you envision yourself, but really try and be open, as flexible as possible. And nursing has many twists and turns that can take you down a lot of different paths. So it's a great opportunity. Talk with anyone that you can about the culture or the values of the location where you would be applying. So if you have a friend that's CNA, or you have another friend that's a nurse that works somewhere already, really talk to them about the things that are important to you. What is the culture like? What are the values of that organization? And if you're applying to a new location, ask for a tour. What is it like there? Let me walk around, see the facility, see the state of the facility, and also you can just kind of read the body language and see what the general atmosphere is on that department. All right, next slide. So when you've gotten yourself to the interview, this is an exciting but also nerve-wracking time. So some things that you can do to help make this the least stressful situation as possible. Obviously preparing. Try to know the basics about the area that you're interviewing for. And if you don't know some of these things, that's a great time to ask. How many beds are in this unit? What is your nurse to patient ratio? These sorts of things. But also, what are the patient populations that you care for? Are they are you a step down unit, or are you, what drips do you run? Like these sorts of things are all good questions to understand coming in if possible, but then also to ask if you're not able to. Also, try to imagine what the job would be like and think about what questions you might have. I just can't emphasize it's really great to interview people that have questions about our culture, about the patients, about onboarding, the training that you get as a new grad. All of these things are important and impact your life and your work-life balance, especially as you're starting. So, think about what's important to you, and ask lots of questions. And when you're thinking about the interview questions, we at St. Luke's use some behavioral-based questions. We know that you know a lot of information. We know that you know all of the nursing information. What we're looking for is good team players. We need people that can fit into the mix with the rest of our staff, that are flexible and adaptable on those sorts of things. So we'll ask questions kind of surrounding how you would respond in given situations, not so much what meds would you give or these sorts of things, but more interpersonal stuff. How would you handle high stress situations or potential conflict with patients, family members, staff members? That's really what we're looking for, is can everybody play nicely in the sandbox? We don't all have to be best friends, but we all have to be on the same team. And like I said earlier, the more happiness we have at the workplace, the better the patient outcomes are and the happier the patients are during their stay. And they really can sense how happy the staff is as things ebb and flow through the years. I see in patient comments, when my staff is happy, the patient comments are so much different than if the staff is unhappy during COVID, during lots of travelers and this sorts of things. Patient responses are just significantly different. Really try to think of some examples, to these questions, and draw from experiences during clinicals a lot. But also, if you have previous work experience, draw on some of those other work experiences, because remember, at least with St. Luke's, we're really looking for the behavior, not necessarily what medication would you give or anything of this nature. We really want to know more about you as a person and how would you respond in these sort of high stress times, because it can be pretty stressful working in the hospital. And again, just like the NCLEX, answer the question that the interviewer has asked. It's okay to go off on a tangent, but if you can, circle back and answer that question when it's all said and done. And I think finally, the biggest thing is, of course, be professional, but be authentic, be true to yourself, and try and relax. There's lots of opportunities out there, and you've worked really hard. You deserve this. You should be here interviewing with me right now, whatever. So you deserve to be here. So try and relax and just take the moment for what it is. Again, ask questions, and yeah, figure out, try to understand, would I be a good fit for you just as much would you be a good fit for me? All right, next slide. So preparing for the interview, again, talking a little bit about this, highlight yourself. Think about the questions, like I said, behavioral-based stuff, and think about, have I made a mistake before and how did I handle that? Have I had a conflict with a coworker? How did I handle that? Was I given directions without a lot of information, and I had to kind of make the best choices I could. How did I handle that? What resources did I pull in? Sort of these sorts of things. And again, like really use clinical situations if possible, but other work experience would be great. But also you're working through school with a lot of soon to be nurses also, so they are also your peers, so there's potential conflict or things that come up in that regards too. So that would be examples from school are also really potentially quite good, especially the interpersonal type of stuff. And again, experience in healthcare is great, but outside experience is also valuable. We're really looking for that behavior type stuff. And again, interview the employer, because this person frequently will also be your future boss. So make sure that they're a good fit for you, that it's somebody that you feel comfortable and safe with. And it's hard during a brief interview, but come into it with this kind of mindset that I want to make sure that this is a right fit for me, not just that I'm looking for a job. So really think about that, and think about what is the training like, what happens if I'm on course with training, if I'm accelerated in the training, or what happens if I'm struggling a little bit. What's the plan? What's the expectation? Those sorts of things. How many weeks is it? How many different preceptors will I have? Preceptors are sort of this double-edged sword type thing, where too many and you get kind of lost in the shuffle and you're having to re-explain yourself every time. But a couple is good, because there's more than one way to complete any task, and it's good to see different ways so that you can kind of determine your own practice, the way that you do things for yourself. So, and again, if I'm hitting barriers, what sort of resources or support can I expect if I'm not kind of firing on all cylinders right away? All right, I'm going to the next slide. So then, as a hiring manager, what do I want to see? I want to see the person. I want to see the real you, and I really want to see that you want this job. Even if it's a second or a third choice, I really want to see enthusiasm for this. And it might not necessarily be about telemetry specifically, although I think the heart is pretty cool. I do think that, a lot of what we do is more universal than just a disease process or disease specific. It's really connecting and interacting with our patients and on the human level. So, there's lots of different ways that you can create enthusiasm for yourself about a prospective location, even if it's not your ideal or your number one location. And I also like to see that people have put some thought coming into this interview. So, like I said, think about questions, think about scenarios, what's important to you, what do you really want to know about this position? And it's just really reassuring to come with questions, because as a new nurse is onboarding, the best thing that we can see is a nurse that asks a lot of questions. If a new hire is not asking any questions and they're going to do things all on their own all the time, that's more concerning to me than somebody asking questions. So questions are good. Teamwork is imperative to be successful in nursing, and that's not just nurse to nurse, it's our whole interdisciplinary team, which is sort of why we ask a lot of these behavioral based questions, because we need to make sure that everybody we bring in is a good team player. We need to all be rowing in the same direction. It's really a rewarding career being a nurse, but it is very demanding. So you want to make sure that you got people that are helping you out, that got your back, and that you're reciprocating that as well. So, no work is beneath anyone, in my opinion, on an inpatient floor. I'm out there answering call lights as the nurse manager. I'm helping patients to the toilet. I'm emptying trash cans. So I try and model that to my nurses and my CNAs, but it takes a village to care for these people. So, we all need to jump in and help out. And then I think the big thing that we really learned post-COVID is flexibility is really one of the most valuable skills to be successful long-term in healthcare anymore. Things were changing daily and hourly with COVID, and since post-COVID, things are still changing quite a bit. So flexibility with a good attitude is really a recipe for success for for your long-term happiness and success in nursing. Next slide, please. So my links in the chain here, you're on a great journey. And like I said, so many opportunities, maybe some you haven't even thought of yet. Or maybe you thought something wasn't for you and you start to get into it and you really discover like, wow, this is really cool. The way that I interact with these patients was nothing like I thought. And I'm really, connecting with these patients in such a unique and different way. Nursing is an amazing career and can take you a lot of places. So be open to those experiences and have a vision and know where you want to go. And, you can stay on that course, but be open to other opportunities because you never know what doors might open along the way. All right, I think that's our last slide. So Wendy has a couple of things here for us. Do you want to talk about these, Wendy?
Yeah, so these are QR codes to apply to St. Luke's if you're interested. We divide them up by geographical areas. So the first QR code is for the Treasure Valley. So that's the Boise metropolitan area. The second one is for Magic Valley. So that's for the Twin Falls area. And we know you have choices. And so just ask you, like Tim said, thank you, Tim, for cast your net wide. One benefit of being part of a system is that you're able to transfer units or hospitals and get a different experience from a magnet facility versus a critical access hospital. And residency programs are not all created the same either. Ours is a year-long ACEN accredited residency program, which we're very proud of, which it's one class a month for 4 hours. So you have a team on your unit of hire, but the residency program just automatically comes with any job at St. Luke's because we want you to have the support and resources over your first year. So that one you'll just automatically be enrolled into. Does anybody have any questions? Well, please feel free to reach out to myself if you have any questions about St. Luke's or employment questions. And if you have clinical questions, we can forward them over to Tim. And just appreciate your time today.
Awesome. Wendy, Tim, thank you so much for jumping in. Tim presenting. That was quite the presentation. We certainly appreciate it.
Of course, happy to.
And a lot of great information there. I had a quick question, if that's okay. And Tim, this will probably be directed towards you. And you touched on it a little bit during the presentation as far as just the importance of mental health and really checking in on those that are working in healthcare. And I think we saw this a ton during COVID. But what are some things that maybe you all do at St. Luke's to prioritize mental health? Is there anything specific that you all do that might be in place to assist those that maybe might be struggling with some things going on? Is there anything specific that you all offer your nurses or just anybody that works with St. Luke's?
Yeah, so we have a few different things. One of the many, but one of the great benefits that we have is an employee assistance program. And this is a pretty broad program and it covers lots of different things. It helps the employees with a lot of different things, including if you need an attorney or if you need lots of different things. But one of the benefits is you get a certain number of sessions with a counselor at no cost to you. It's not part of our medical health plan. This is its own separate thing. And you get, a certain number of these every year. And if I have one that I'm dealing with, I'm struggling with a child that's developmentally late or something that's really impacting me in my work, I can reach out to the EAP group and help come around that. And then if I have a situation where, I had a situation with a patient that impacted me, I could reach out to them and get another set of sessions for that thing specifically. So the EAP program is a really good resource for staff in that way. In addition to that, there are, unfortunately, there are acute scenarios that happen, especially in the hospital, whether it's a code gray patient that's escalated and, combative or violent or whatever the case may be, or if it's a traumatic code blue that, this patient was healthy and had some really traumatic thing and it really impacted the staff. We have a team that's like a group of social workers internally within St. Luke's that responds to critical incidents. And they are therapists that come to your department within 24 hours and just debrief with the staff. And they'll have ongoing communication with staff too, especially if, like, I as the manager say, I have this one person that really was struggling with this person that was here for 35 days and it's just really lingered with them. Can you reach out to them? They'll connect with this person offline. And I don't know the outcomes, I don't know the situation, but I just say, me as the manager caring for my team, I know they need some help. Can you just check in on them? So this critical incident safety, and I don't remember what the acronym stands for, but we call them CISM. So that's in addition to the EAP, the Employee Assistance Program.
Awesome. Thank you.
Yeah.
Well, thank you so much for the information you provided. Although this was geared towards, nursing, I still felt there was some information I could take away as far as tips that you provided as far as the interview and what to expect. Me, I'm just finishing with my bachelor's and I'm more on the administrative side of healthcare.
Okay.
But the information that you provided, it allows me to, apply some of this information on the administrative side,
Yeah.
So very good
Well, and I
information.
think, really, this is a team effort, and I talked about the interdisciplinary team. That includes, it's everybody from like our housekeeping EVS to food service to respiratory therapists to phlebotomy to our administrative assistants that help coordinate meetings and, people that are overseeing like our diabetes group that come in, and they're not necessarily patient care here, but there is so many fingers in the pie that it really takes so many
Village, like
people.
you said.
Yeah, and your impact really goes beyond exactly what your role states.
That was the thing when after, you kept mentioning COVID. I think COVID had an impact on people in so many different areas. For me, I was doing customer service for the past 10 years, working from home. But then when COVID happened and a lot of those jobs got let go, it had me thinking from a whole different area, like, okay, I need to make myself more marketable. I need to lean more into, with this whole COVID, there's always going to be a need for healthcare on some aspect, and although at my good old ripe age, I decided to do this, there's still a need and there's still a place for me in that field, and
I think,
I like
yeah.
to help people. And I want to become a part of that area, that field.
Well, I think life experience brought into this really is invaluable,
Mhm.
and I think I talked a little bit about authenticity and being genuine. This happens with the people that we interface with also,
Mhm.
whether it's a patient or another provider or other people within an office space, just bringing that life experience is really, really valuable, even if
Yeah,
it's not all healthcare related. So
right.
that's fantastic.
Yeah, yeah, I'm excited. I didn't think that. In all transparency, getting to the end of your course, you don't actually feel that excitement until it's done, and you're
Hmm.
like, okay, I'm ready. I'm ready. So I'm just excited, and I'm going to and I do appreciate WGU for all the resources that you guys provide. for after the fact. That's very, very helpful. And I'm just grateful to be a part of all of this and just to take advantage like a sponge on everything.
Well, that's awesome. Congratulations to you.
Thank you.
Congratulations.
Thank you, Christy.
Thank you.
Awesome. Great. Well, again, Wendy, Tim, thank you so much for jumping on, presenting. This was fantastic. Just a reminder, this was recorded. It'll be sent out. And those that are maybe going back and reviewing this, definitely fill out that survey. We would greatly appreciate it. And then from there, what we'll do, we can wrap up. Any closing words, Wendy, Tim?
Nothing from me.
Nothing from me,
Thanks
but
for the
thank you so
opportunity.
much. Yes, appreciate
Awesome.
it.
Awesome. Well, thank you. And everybody have a great rest of your Tuesday. Or no,
All right.
yes, Tuesday. My
Tuesday.
days are getting mixed up. All right. Have a good one.
See you
Thank
guys.
you. Bye-bye.
Bye.